Hey everyone, it's Dr. Erica Person and welcome to an episode of the Flex Audiology Show. Today we are going to fully cover what happens during a tinnitus evaluation. I get this question a lot when people call in, and that's what we're going to cover. So if you've ever wondered what actually happens during a full evaluation, this video is for you. If you like our content, please take a second and hit that subscribe button because it really helps us grow our channel. So a tinnitus evaluation is much more than just a quick hearing test. And I think that's where there's some confusion. So it's a really in-depth full investigation into why you're hearing what you're hearing and what can we do about it. So let me walk you through the process pretty quick. So when you schedule an evaluation with us, you are going to receive a pretty lengthy questionnaire. We highly recommend that you take the time to do this questionnaire before the appointment because it usually takes you about 20-30 minutes. If whether it's with us or you're going someplace else, it should be a pretty extensive case history. Really, we want to hear your story. When the tinnitus started, what does it sound like? What makes it better or worse? Is it affecting your sleep, your focus, your stress levels? How often are you having sleep issues, stress, focus levels, things like that? We want to go over your medical history, different medications, conditions, disorders that you might have, any history of noise exposure. So really take the time. This is your time to share with us exactly what is happening and how it's affecting your quality of life. And tinnitus, it can really be triggered by a long list of items. It can be hearing loss, it can be stress, TMJ, circulation, medication, supplements, earwax. And so the first step that we're looking at is trying to rule out any medical cause that could be addressed by either your regular physician or if we were to refer you over to an ear, nose, and throat specialist, okay? So let's just jump into the ear exam portion. So once you've got the case history, you've come in, we've reviewed that, we're going to take a quick look in your ears using an otoscope. Sometimes it's just earwax, or I have had dog hair or cat hair that I have removed and miraculously the tinnitus goes away. So anytime you have something abnormal pressing up against your eardrum, that can create tinnitus, or it can even make it seem louder than worse than what it really is. So those are, that's the easiest thing that can happen, and we love that when that happens. Next, we're going to jump into the hearing evaluation itself. And this isn't just your old raise your hand when you hear the beep kind of test. So we are going to measure how your ears respond to different beeps, different frequencies, different volumes. 80% of people with tinnitus have some form of hearing loss. And so if the brain is not getting a clear signal, an absence of a signal, a staticky signal, it will try to fill in the gap. And that's often when we're perceiving that tinnitus. It's something your brain is creating because it loves to be stimulated with sound. We're also going to be checking your speech understanding and how your auditory system handles different listening levels, and that gives us insight into how your brain is processing sound. Typically, we're going to do a tinnitus matching test. Sometimes, depending on how your tinnitus is perceived, we are not able to accomplish this task. But for most of our patients, we're going to be presenting different tones at different volumes, and we're going to try to match exactly the frequency and the volume of what you are hearing in your ears. And it helps me figure out just really how loud you're perceiving this sound. A lot of times we'll use that information when we talk about different therapy options. And then also we'll do a little masking test during that time frame just to see, is your tinnitus, is it going to do a slight peak? Will it be the same? Does it fade away just with a little bit of masking? Sometimes people can get they'll get extra stressed that it could potentially make your tinnitus worse. And so I want to be super clear that if that happens, it's it's a short time period. Usually by the time we're done testing, the tinnitus has calmed itself back down. But that's important for us as clinicians to know, is what's going to negatively impact the tinnitus as well. We're also going to run what we call UCLs. It's uncomfortable loudness levels. Now, if you are super sensitive to loud sounds, hopefully you shared that on your case history and that's something that we're walking through. We're not going to try to find that level that's painful, because if we already know that you're sensitive, the last thing we want you to do is be miserable by making it super loud and uncomfortable. But what we're going to do is slowly work with you and move you up to that level to where it's right before it would have become into that uncomfortable framework, because that gives us some information as well. Also, again, we use that data to shape and control some of our therapy options. So it's super important that we do that. And then lastly, we're probably going to run otoacoustic emission testing. And this tests your outer hair cells. This test is really nice for people that don't have any auditory damage that we can see on paper, but we want to see if maybe those outer hair cells are actually damaged. It's just not showing up on your traditional beep test. And so it'll show us really the early warning signs of missing signals making it to your brain. Okay, so then what we're going to do is we're also going to look at the impact of how the tinnitus is affecting your quality of life. So again, we probably are going to have 2 or 3 different questionnaires. Some of them we may have sent with the initial intake paperwork. Some of them we like to do in person. And again, this helps us tailor the specific treatment options that are available to you, because some of them you have to score a certain way on those questionnaires to be a candidate for certain therapies. And then lastly, we're going to really kind of sit down. We're going to review everything together, what's causing the tinnitus, what we found through the diagnostic testing, whether or not we need a medical referral. And then depending on what you did on your habituation test, the masking test, we may put a demo of hearing aids on you just for some initial sound therapy to see if that helps it, if you get immediate relief. Some patients we've had to have them just wear the devices for a week and come back. The reporting back to us is what helps us determine next steps on your treatment therapy plan. So a lot of different things can happen. Again, you may not do that demo with the devices depending on what you found. And it may be that we're talking about other treatment sound therapy devices that we can work with. And I mean, that could be something just as simple as picking up a sound pillow, or maybe a headband therapy session. So if you guys have any questions, that is what happens at our clinic for our tinnitus evaluations. Most of my colleagues that I've spoken with, they're super similar in that framework. Some clinics have the ability to do what we call extended high frequency testing for your hearing. So even though you're normal within the speech range, they will start to see the beginning hearing loss damage way out in that frequency. So maybe some minor tweaks here and there. If you guys have any questions, let me know. If you're looking specifically for a provider that specializes in tinnitus, I highly recommend that you go to the American Tinnitus Association. You can search by your demographic, your geographical region, and find somebody close to you. I think it's important that you find somebody that's within your fairly immediate area to work with. That's going to give you your best results. So hope you guys have a great day, and we'll talk to you at the next episode.